Question on cancer screening. If one had a family member, grandmother, who had colon cancer, should family members get a colonoscopy if over 50? First of all, your grandmother had it. Did her grandmother have it? Did her mother have it? Did her father have it? Did her siblings have it? Cancer doesn't really run in families. And when it does, it really runs in families. So there are a few, we've talked about before, like Peutz-Jeghers, familial polyposis. There are a few where cancer is very, very high, and that's just due to the fact that they don't have the enzymes to repair cells. But they can still be averted by eating and living healthy. But in the average person, like for you here, if you've only been able to identify one person who stands out, if you're not saying that I had all these people, but even then, we have to remember what really runs in families is lifestyle, right? I'm Italian, so I grew up eating pasta, bread, potatoes, sausages, meatballs, brajol, all this stuff, right? Every Sunday morning I'd wake up smelling the sauce. And in my family, everybody had diabetes, everybody had high blood pressure. So I could say, diabetes runs in my family. High blood pressure runs in my family. No. What runs in my family? Meatballs, sausages, pasta, bread. If I don't eat that stuff, I can't have diabetes. So what runs in families is culture, lifestyle, et cetera, et cetera, et cetera. So should you get a screening test? You could, but what are you going to do with the answer? You think you have it? Are you bleeding? And there's no reason to go rush out and get it just because you're not. There's no your stools are not bloody. They're not real skinny. If none of that is happening, and you're not having like pain, or you're not losing your none of that, so don't worry. Wait until the hospitals are functioning, or you go privately to a gastroenterologist to his office and get a colonoscopy if you want to do that. But then Then you got to think, what are you going to do with the results? Okay. And so what you should do now, whether or not there is anything that's there is live a lifestyle. Remember I said that which is required to be restored to health, the same is required to maintain health. So that's what I would do. That's what I would recommend.